match exactly and I see errors.
Yeah, we saw the insulin.
Yeah, and then the date wouldn't work. But anyway, I'm going to do furosemide or the insulin 2 units. Oh, this doesn't match. Okay.
But we're going to pretend it matches, right?
Wow.
Are you guys gonna do that to us? Purposely not make it match?
No, I will not. I will not do that.
Okay.
No, this is an error that I tried to make it quickly so you had something to check to work with.
Yeah.
And pH 8 units and 15
Yeah,
units.
we saw that too.
So I'm gonna keep this and I'm gonna. Okay, and I'm going to check it all. And as I know that it's all right, then I'm going to put my initials here. Furosemide 40 PO daily, yep. NPH insulin, KCL, LAD, Vicodin 5, LAD. Well, I'm checking it. So now that I checked it, I'm going to put my initials here. RN, okay? And I'm going to do noted L Dolan RN, date and time. So I'm going to know that this is all right. Let's see, allergies, no known allergies. Let me see, this patient has no known allergies, I guess. It's going to say someplace that this patient has no known allergies.
Oh, yeah.
No known allergies, thank you. So, and the patient is going to confirm that when I see him. So I'm going to take this. I'm checking his allergies, and are they appropriate for him? Let's see, this guy's diabetic, so yep, the insulin's appropriate for him. He's got COPD, so they're giving him Lasix to pull off fluid so he can breathe easier, and because Lasix wastes potassium, we're going to give him a potassium supplement. And he's having pain, so we're going to give him a Vicodin. It's ordered every 6 hours. And Rosefin IM for the infection he's going to get because he's got COPD and fluid in his lungs. So this is all appropriate. So I've done those 4 things. Okay. Now I'm going to go pull my meds. So now what I'm going to do is I'll have them pulled on a cart, and you just select them. Okay. So you're going to go. I'm going to pull the insulin, the regular, the NPH, the furosemide, KCL, Vicodin, and Rosefin. And I'm going to take them on this cart. I have all my meds here. I'm going to have all my meds here, and I'm going to check all the expiration dates as I'm pulling them. Okay, I'm going to do my first med check. Elizabeth Chin, on this, not on this, because I've checked it all. Elizabeth Chin. You know what? I had them all pulled from Raj.
Oh, I'm sorry.
Anyway, I'm going to do that. So I'm going to have them pulled. I'm going to pull them and look at each one. The regular insulin, sliding scale. His blood sugar was 4 units, so was 131, so I'll give him 4 units. Regular, NPH 15 units, okay, 15 units with it. But what you're going to do with it, I wish I had it in my hand. Where's the insulin? So I'm going to go regular insulin. Elizabeth Chin, regular insulin. I'm going to give 4 units for blood sugar 131. Subcutaneously, the time is whatever the time is now, and I will document this later.
What if her blood sugar is like too high?
Too high, I'd call a doctor. We're not going to do that. I'll give you a blood sugar of, I'll tell you that it's 130, and these are, maybe I'll write it on the board. This is what the blood sugar is, these are what the vital signs are, go by that. Okay, and they're not going to be where I'm going to trick you. I will not trick you. This will be straightforward, all right? Yeah, I'm not going to, see here I've got wrong dates, and I'm not going to do that. It's going to be all right, okay? So, second one, NPH. Name is Elizabeth Chin, NPH. insulin. 15 units, 15 units, sub-Q. The time is, and I'll document it later. Next one, Lasix. So I'm going to do Lasix. Elizabeth Chin, Lasix, 40 milligrams by mouth. The time is 2 o'clock, and I'll document it later. KCL. Let's see, Elizabeth Chin, potassium chloride, 20 milliequivalents, by mouth. The time is 2 o'clock, and I'll document it later. So you're going to just do this every single one, 3 times. Elizabeth Chin, Vicodin, 5 milligrams to 500 milligrams, 5 to 500 milligrams, by mouth. The time is 2 o'clock, and I'll document it later. Okay, Rosefin. So Elizabeth Chin, Rosefin, 300 milligrams, IM. Time is 2 o'clock. And I'll document it later. Okay, so I pulled it, I pour it. Okay, so the second time I'm going to pour it, and this is where you're going to do your insulin injection. You never turn your back on your meds. If you do, you're contaminated. So, never turn your back on your meds. Okay. So it was 131. I'm going to give her 4 units. So I'm going to pull it up. And Jeffrey, you're my nurse friend. That's going to help me. I'm going to put in the cloudy first. 15 units. So 10. 2, 4. Okay, that's 2, 4, 15 units of air. 15 units of air. And I'm going to put it in without the needle touching anything. Okay, and now I'm going to put the air in the regular insulin. 4 units. It's 4 units of air.
So you got the number of 4 units through.
Because it was 131. So I'm going to put it in here. Then I'm going to turn it upside down. I'm going to drop 4 units. You see me? See 4 units?
Yes.
And I'm showing you the regular. Okay. Now, this is NPH. You need to roll it. And now I need 15 units of this, so I'm going to put this in. And 15 plus 4 is 19, so I'm going to draw it up to the 19.
Well, what if you draw too much? Do you start over?
Throw it away and start all over. Okay, that's about 19 units. And I've got air bubbles in there. That's not good. One thing, water and insulin have different viscosities, so it won't act like this. So that's 19 units, and you're going to sign your life away.
19 out of 20.
Okay, and I'm going to document what the heck this is.
Sign that I verified 19.
Yep, you're going to put your initials by mine, and you're going to sign it there. Insulin.
Hey, I had to make
Okay.
that sound.
Huh?
I know. We were talking about our med matches. Sorry.
You got the 4 units just because of what.
Yeah, what
it
I'll
says
do,
on the bottle.
is I'll put vital signs and blood sugar on the board, and that's what you'll check off on. Okay? So you'll have to figure that out.
So it's like checking in and afterwards, and we'd say, oh, we come in, checked them, or
So
assessed their
the
vitals.
assessments,
That's their vitals,
we already got the
that's their blood
assessment.
sugar.
Then. So the
Yeah.
assessment's
And
already
then so
been
that'd
done.
be okay to go.
I'm giving you those.
Okay.
Okay. So I'm pouring now the furosemide.
Lasix, we have.
Okay.
If they have a pain, if they've already said that they have pain, I'm asking to rate their pain 0 to 10. Tell me where the pain is at and how often it's pain, what they feel like. And I'm gonna go off.
Pour it in.
Yeah.
If you don't do this, no, because the inside of the cap is the same. So I've done that. KCL. Put your your hand over the label so you don't get it dirty.
I am gonna go wash my hands. Okay.
So 40 milligrams, I have to do a little bit of mid-math. There's 20 milliliter equivalents for 5 mLs. We want 40 milli equivalents. No, 20 milli equivalents. So that's
So
5.
10.
20 milli equivalents per 5 mLs, and we only want 20. So that's just 5 mLs. So I've got my hand here. I'm going to go on eye level, and I am going to pour 5 mLs. And I'm going to have that labeled.
And I'm gonna compare my medication with my mark.
It's not writing very well.
All liquids label. All liquids label.
Yeah, well, everything. Then we're going to do the Vicodin, and we're going to do the Rosefin, and I'm going to do Elizabeth between regular insulin, 4 units for blood sugar of 131, 4 units for blood sugar of 131, subcutaneously. The time is 2 o'clock, and I'll document it later. Elizabeth Chin, NPH insulin, 15 units, subcutaneously. The time is 2 o'clock, and I'll document it later. Okay, so we have furosemide. Furosemide, Elizabeth Chin, furosemide, 40 milligrams, 40 milligrams, by mouth. The time is 2 o'clock, I'll document it later. So, yeah. You get this? It's just Elizabeth Chin, KCL. 20 milli equivalents, by mouth. The time is 2 o'clock, and I'll document it later. Vicodin, 5 milligrams for 500, 5 milligrams for 500, PO, Elizabeth Chin. The time is 2 o'clock, and I'll document it later. And we're going to do Rosefin, and not going to do Rosefin, but you do the same thing. Elizabeth Chin, Rosefin, 300 milligrams for IM, every 12 hours, times 10 days to every 2 hours, 10 days. Time is 2 o'clock, and I'll document it later. So I've done it all. I'm going to go into her room, knock. Hello. Elizabeth Chin, my name is Luann.
You have a copy of the MAR and the MAR? Or the
Doctor's orders?
Doctor's orders.
Here, I gave you some, and then
That's
you're
it.
going to have to copy more.
Are you guys using this?
No.
Here.
Because we checked it all. So, hand hygiene. Hello. Elizabeth Chin, can you tell me your name and your date of birth? And no allergies. Okay, thank you. Okay, I'm going to do my last med check, and then I'm going to give you your medicines, okay? Hang on a minute. So, Elizabeth Chin, regular insulin, 4 units for a blood sugar of 131. The time is subcutaneously, the time is 2 o'clock, I'll document it later. NPH insulin, Elizabeth Chin, NPH insulin, 15 units, subcutaneously, the time is 2 o'clock, and I'll document it later. So, furosemide, 40 milligrams, by mouth, Elizabeth Chin. The time is 2 o'clock, and I'll document it later. Elizabeth Chin, potassium chloride, 20 milliequivalents, by mouth, the time is 2 o'clock, and I'll document it later. Vicodin. Elizabeth Chin, Vicodin, 5 milligrams to 500 milligrams, 5 milligrams to 500 milligrams, tablet by mouth. The time is 2 o'clock, and I'll document it later. Okay, and the Rosefin, if we were doing the Rosefin, it would be Elizabeth Chin, Rosefin, 300 milligrams, I am. The time is 2 o'clock, and I'll document it later. Now, where's gloves? Okay, Elizabeth Chin, where did you have your last injection? Right here. Okay. So what you do, here's the belly button. You have to be about 2 inches from the belly button.
Is there any direction or does it be towards the bottom? 2 inches.
This is in the way, but 2 inches from the belly button. You clean it from the center out, let it dry. And you'll have gloves on. Where's gloves?
Back behind you.
You don't have to have gloves on to pull it up, but you just to administer it, you have to have gloves on.
Mr. Bennett, I'm going to go ahead and get you some water so it'll be easier for you to go ahead and swallow it.
Okay, I'm going to go ahead and give it to you. Pinch 2 inches. Pinch 2 inches. You give it, push it, and you release and you pull this out at the same time. Okay, and you're going to make sure that they have something to eat right next to them because you just give them insulin and they're going to have hypoglycemic reaction. Okay, let's switch up so we can give you your pills. I've got a little bit of water here. Is that okay? And how do you want them? Do you want them all at one time or just one at a time? All at one time, delightful. So I have my Vicodin, I have my Lasix, I have my water. Here you go. Chug a lug. Did they all go down? Let me see. Okay. Okay. Now I've got potassium. Would you like to take this straight and chase it with water or juice? Or do you want me to mix it with juice? Straight? Great. Okay. So here you go. Okay. Did you get that all down? Good. Okay. Now, Lasix is going to make you urinate, so I've got your urinal right here. Here's your call bell to call us, and I'll be back in 10 minutes to check you.
Need your number so I can
Because
text
I want to
you.
make sure that she doesn't have a hypoglycemic reaction, so I'm going to make sure her skin is warm and dry, and she's not passed out, and she's not confused. They get very lethargic and confused when they have a hypoglycemic reaction. So anyway, so I'm done with that, and I'm going to do hand hygiene, and I want to see that you're properly using the sharps container. Okay? Anything you can do?
The side effects, check for side effects afterwards.
Yeah, you have to check for side effects. The side effects for Lasix are, it takes about 60 minutes to work. It takes, and then you're going to make you urinate. It can mess up your electrolytes. It can mess up your EKG, so we're going to be monitoring your labs for your electrolytes. We're going to be monitoring your intake and output because it's going to make you urinate, and we're going to make sure that your EKG isn't showing any abnormalities. Potassium chloride can just cause a little GI upset, and that's why we give it to you with a little bit of juice. But it's just a supplement to replace what the Lasix is wasting. So we'll follow up with your labs with that too. We'll draw the blood for the electrolytes for the Lasix and the potassium. We're going to be checking it at the same time. Okay. So we're going to be talking until 3 things. Anything else?
That's it.
I think you can do it. It's really redundant.